Assalamu alaikum. Today, long clinical consultation. We will start with Mrs. Dina Salmon, 65 years. Came after urinary tract infection treated by antibiotics. She has nausea and vomiting. For the last 24 hours with rising kidney function tests. The task is to assess the problem and address the question for her. Okay, we'll start after the timer. Okay, let's start. Hello there.
Hello.
I'm Dr. Mukhtar, the doctor in the ward today. You must be Mrs. Dina Salmon.
Yes, I am doctor.
You are 65 years.
Yes.
We are here to discuss about your health issue. That's okay for you.
Okay, doctor.
Can you tell me more about your complaint?
Well, doctor, they said you will explain to me my condition. I really have last day some problem in taking in eating and to drink any fluid, and I struggle to eat anything. I don't know why, except from this day I am here in hospital. I eat good, and this is I feel better in the last 2 days, but I don't know what happened last 24 hours.
I'm so sorry to hear about that. Let's ask you some question and I will address all your concern. So
Okay.
you have been fine for before the last 3 days, and when you have admitted to the hospital, today you don't feel well, right?
No, Dr. Lely, the past week I was not good at all. I feeling pain when I passing urine. It is for about 1 week now. I trying one medication prescribed by my GP, and the pain is worsened. So I came to your hospital 3 days ago, and they admit me here, starting me on some fluid in the first day. Then I become good, really. Just last night, I feel nauseating. I feel I can't eat or drink anything.
Yeah. Okay. I appreciate your concern, Mrs. Dina. Okay, let's. I ask you some questions. Is that okay?
Okay, doctor.
You have any long-standing disease?
Yes, doctor. I have diabetes, and I have high blood pressure for more than 15 years.
Okay. Apart from this, you have any problem in your water work system? I mean, any previous infection?
True, doctor. I few years ago, I have been seen like that, and they did to me some scan. They expect some like stone in my kidney, but it's okay, and my condition settled also on antibiotic.
Okay. Any stone coming recently out?
No, not at all.
Any blood in the water work?
No.
Okay. For the diabetes, what you are taking?
I am on metformin 1 gram.
So you are type 1 or type 2
BIT.
diabetes?
It is just 15 years.
So type 2 mostly, okay. And how is the follow-up? Are you on the regular follow-up?
Yes.
Any problem in your vision?
No, doctor.
Any problem in the, apart from this kidney, any frothiness in the urine?
I don't know, doctor. Really, I have little urine the last night.
Okay. Any problem in the legs? You have any pins and needles or weakness?
No.
Okay. For the hypertension, what you are taking, Miss Dina?
I taking Ramipril, and they keep it till yesterday. I trying to take at night, but I vomited.
Okay. I'm sorry for that. Apart from these two medication, you are taking any other medication?
No, doctor.
Any over-counter medication?
Yes, some occasional paracetamol.
Are you taking a medication called non-steroidal anti-inflammatory like Brufen?
Yes, I tried this when I come here at hospital because I have much pain in my back. But I can't take the last also day, doctor, because I have really feeling sick.
Okay, so you are taking this Brufen without medical advice or just the last time?
No, I already tell the staff here and they allowed.
Okay. You are allergic to any medication or antibiotics?
No, not
Any
before.
surgical, any surgery before?
No,
Okay. Um, any family history of the same problem? I mean, kidney issue?
no, doctor.
Okay. Apart from this, you have any headache?
No,
Okay. Uh, any weather preferences?
no, doctor.
Any chest pain?
No,
Any heart attack or any,
no, doctor.
okay, any awareness of your heartbeat?
No.
Okay. Any short of breath?
Really, doctor, I don't know, but I feel not good from the night.
Okay. What you mean? You are taking, you are
I feel I
gasping?
can't. Yes, I feel I have some dizzy. And I am gasping for to breathe. Like I am very weak to take deep breath.
Yeah, yeah, I see. Okay. Are you using more pillows now today or this night?
No,
Okay. You are dyspneic or you are short of breath overnight when you sleep?
no, but I notice that I have some sweating and uh, feeling some high temperature at night.
Okay. Any cough,
No,
coughing up blood?
no,
Any leg swelling?
I don't notice, doctor. No,
Any blood coming out from your nose?
no,
Okay. Any noisy breathing?
no,
Any difficult swallowing?
no,
Any change of your bowel habit?
no.
Okay. Apart from this, you told me about back pain. When exactly this back pain started?
On both sides, doctor, on my back.
Since when?
Just start yesterday.
Okay. And is it traveling up or down?
I feel some tummy pain from start when I come here, and I feel like this tummy pain become now at my back.
Okay. And you have any pain now?
Yes,
If I give you scale from 0, no pain, and 10 is the maximum, how can you scale your pain?
since it's about 7, doctor.
You need any painkiller right now?
As they give me, doctor. Thank you.
Okay. You think the pain is going down to your private area? Sorry for this question.
I don't notice that, doctor. I didn't.
Okay. You told me about high body temperature. Was it before or just yesterday?
Yes, all last week, but it is slightly improved. When I came to hospital 2 days, then start worsening again.
Any night sweat?
Yes, last day on.
How high the temperature, you remember?
No, doctor, I'm not
Okay, any
asking
lumps or
about.
bumps?
No,
How's your appetite?
very poor, doctor. I'm feeling sick, and
And
already I vomit 3 times yesterday.
how's your weight?
I think no change.
No change.
I don't
Okay.
know.
Any travel recently?
No, doctor.
Do you smoke?
No,
Have you ever smoked?
no,
Do you drink alcohol?
no, doctor.
What's your job, Miss Dina?
I'm retired. I was
And what's
bank
yeah,
bank
what's
clerk. Yeah.
okay. And you are supported at home.
Um. Really, I am independent, doctor, but I live alone now. But my daughters live nearby.
Okay. You have contact with any sick patient?
No,
Any patient in the family has the same problem?
no,
Any family member has disease called TB?
no, doctor. I don't know.
Okay. Sorry for this question. You don't have periods, right?
Yes.
Do you think you have HIV?
No, doctor. I didn't check. No one tell me that I have something wrong with me.
Okay. Can I examine you?
Okay. What you need to
I will
examine?
start the vitals. How the blood pressure? Is it low?
It is like in the chart. Yes, it is slightly low. 175. The pulse
Okay.
96, and she is
Any
at febrile right now.
any signs of dehydration?
Yes. What you will do?
The dizziness? You feel dizziness while standing from sitting?
I feel some dizziness, yes, but
Yeah.
it is
Okay.
always
Yeah. Can you check the blood pressure sitting and standing?
no change.
No change. Okay. The skin dry? The
Well,
hands?
yes, what you will do? Yes,
Yes. The texture of the skin? Capillary refill?
yes. It is slightly delayed.
Okay. Any signs of clubbing or pulmonary edema?
No,
Any glucometer break, skin break for the blood sugar?
okay, normal.
Normal. Okay. I will go to the face. Any pallor, jaundice?
No pallor, no jaundice,
The mouth? Any soreness in the mouth?
no, just dry.
Okay. Now I will examine the abdomen. Any abdominal pain?
I feel lower tummy pain, yes.
Yeah. And going to the groin.
Okay, what you will do and what you will tell the patient?
Lymph nodes. I will offer lymph nodes in the inguinal.
No need.
No need. I will palpate the kidney. Any palatable kidneys?
No,
No. I will offer the examiner to ask for any genitalia change, I mean discharge coming out or pus.
nothing, nothing.
No need. Or
Mm,
nothing.
nothing.
Nothing. Okay. Any puffiness around the eye?
No,
Any leg swelling, edema, pitting edema of the leg?
no.
Okay. I will ask for fine and tremors. Sorry, I didn't ask this. Fine tremor or flapping tremor for uremic encephalopathy.
No, nothing, no.
It's not signifying anything. Okay.
Mhm.
Okay. Any abdominal pain at all?
Yes,
Okay.
if you will hear, will
In the
ask,
flank.
she will tell, she will, yes, she will mark as lower tummy pain and the back pain and the loin, both loin.
Okay. You have the previous infection while your child in your waterwork system?
Just 3 years back, doctor, that I tell you about one episode.
Okay. I can examine the chest for heart failure, crackles, any back bibasal crackles,
No bypassal circles,
any raised GVP,
no raised GBV,
Okay, what's your concern?
Well, doctor, I they tell me that they will stop my blood pressure tablet. I already didn't take yesterday. I fear that I will have a stroke like my mom.
Yeah, any
Can you?
weakness right now?
Mhm.
Any weakness you have in any side of your arms or your legs?
No. Can
Okay,
you
so
permit this for to use anything for blood pressure?
yeah, I appreciate your worry, but actually for your low blood pressure reading, we have to stop this medication. You have other concern.
Yes, doctor. Will my kidney recover? That they tell that I have some problem in my kidney.
Yeah, actually, it might be related to the antibiotics, and it might need some time to recur back to its normal function. We will update you with follow-up and monitoring. You have any other
Okay.
concern?
Thank you.
Okay, time is up. Let's start the examiner question. Yes, you can start now.
Okay. What is your differential in this case?
Yes, my differential UTI complicated by pyelonephritis.
Okay.
This is the first. Second, uremic or ATN due to antibiotic gentamicin, acute tubular necrosis.
Yes. Okay.
Third, differential interstitial nephritis, again due to the antibiotics.
Mm-hmm. Other?
Others, renal stone, complicated by hydronephrosis and again hydronephritis.
Okay. Um, what is your explanation about deterioration the last time?
Yeah, so on top of my differential sepsis and related to the UTI and ascending urethritis and kidney pyelonephritis due to the bacteria and bacteremia and pre-renal azotemia due to decreased oral intake
Mhm.
might lead to this kidney affection. The second could be the drug nephrotoxicity like gentamicin. And the
Okay.
last
What
might
is
be
your first
reaction.
action? Okay.
Yeah.
What's your first action in this case?
First action, good hydration, and I should start ABCD approach for the hypotension sepsis. I might need referral to ICU for further management and change antibiotics to IV. And also multidisciplinary team approach, including the nephrologist, infectious disease, and septic screening should be sent to screen for the possible organism, starting by urine and blood culture
Mhm.
for biogram, and start broad spectrum antibiotics.
Okay. In the event of persistent hypotension, despite fluid resuscitation, what's
Mhm.
your next action?
Yeah, I will consider this patient having urosepsis or complicated pyelonephritis, and it might need some intervention radiologist for drainage of the abscess if the patient have renal abscess. So before that, I could do some imaging to the kidney, starting by ultrasound, and I could consider CT/QUB to
Mhm. What is
detect
the
any
management of obstructive uropathy?
obstructive uropathy, starting by multidisciplinary team, including the urologist, along with the radiologist, to detect the site of the stone. And according to the size of the stone, it will be managed accordingly. It might need G stent with the ascending cystoscopy, and some patient might need crunching or what's called for the stone, large stone. I forget the name. To crush the stone, and after that we can aspirate this stone by cystoscope, ascending cystoscopy.
Okay,
Yes, lithotripsy, yes.
for medication patient on it, what we will do is the regular irregular medication.
Yeah, for the antihypertensive, I should hold all antihypertensive medication right now because patient in sepsis. For blood sugar, I could switch oral anti-glycemic medication to insulin to be in controlling her diabetic. Should be her blood sugar between 100, around 150. A tight control of the hyperglycemia. And for the antibiotics, all antibiotics should be adjusted according to the creatinine clearance and estimated GFR.
You will consider changing the antibiotic in this case?
Yes, I will upgrade antibiotics to broad spectrum and including either tazocin and some antibiotics for MRSA because patient now hospitalized for around 1 week. So I could add linezolid or vancomycin according to the guidelines of the hospital.
Okay, thank you.
Okay, thank you.
Sorry about the strange case.
No, it's okay. We have to have.
Okay, you're doing very well. Just a few points missing in the history.
Yeah.
You will ask here specifically about family history of any disease, of any problem in family. You ask only family history for kidney disease, okay? You will tell her also, you will ask her about how many she going to for water work and if she notice any decrease in it. You will ask also about her vomit, what is kind of vomit and how often she vomit and if she has tummy pain before vomit, like to analyze the vomiting. So also you will ask about if she took her medication from admission that she said she is on regular medication. This is in history. In examination, I think you did all, just the arrangement of examination, like just to start by 1, 2, 3, not to jump from 1 to 1. Okay, yes. So first you will see the, like you said, dehydration. You will check the vital sign. You will see if she is hypovolemic, evolemic, and or overloaded, because this all possibilities. GVB after that. Then you will see the nail fold for infarct, so you will exclude vasculitis and any rash for particular rash in streptococcal sepsis, and also vasculitis like noxious Lyme berbera rash. So you will excuse or take permission to see all this. If you, I need to see if any lower limb rash, if any back rash, if any in the hidden area, you will take permission. But in the nail fold, you will see, and in the any exposed already area, you will see without take permission. Okay. For then you will go for lung. You will show any evidence of pulmonary edema, as you said. Then for abdominal, you will excuse her first. If you feel any pain, she will tell you that she feel this pain here. So you will excuse from the examiner. I need to examine. If he tell you okay, you can examine, but gentle palpation to suprapubic area. So she will tell you yes, here it is tender, and for loin also she will tell you. You will not do palatable because it will too painful. So you will just palpate the kidney and she will say that it is tender in both sides. After that, you will go for lower limb, any edema, any changes in the leg. Then you will observe. You will ask, I need to complete my examination by checking the blood glucose result and urine analysis and urine dipstick. And I need also to see the observation chart. This is very important to set in the end of your, when you see the examiner. I need the observation chart. So you will notice what time exactly the blood pressure drop, what time exactly the pulse rate up, and what time exactly the temperature go and come. For this patient, the differential diagnosis here, acute kidney injury for diagnosis. It is maybe from sepsis, pyelonephritis, and in combination with dehydration, maybe it cause also added effect. So it is pyelonephritis, added effect by dehydration. So she developed kidney injury from dehydration the last night. This patient use also NSAID and ACE inhibitor, and diseases can be possible also in added also pyelonephritis on added these drugs. It can deteriorate more the kidney function. You will possibly consider also chronic vascular disease due to diabetes and hypertension, although she said that she is fine and taking his medication and of regular follow-up. Okay, for concern for the patient, you will try to explain more. You will not take this blood pressure medication as you have low blood pressure now, and also this medication can harm your kidney right now, or maybe he is the cause of harm of your kidney. For the other concern, she said, do I need any dialysis or transplant? You will said it's too early, but at this kidney function or at this number of your function or the results right now, we no need for dialysis at this time. So you will be like true on with the patient. You will not do dialysis now. If this is deteriorate, we may need dialysis. Right now, we will give you some fluid and give you some medication to stop vomit and to stop feeling sick. For management with the examiner, what is the first management for this patient you will consider? You will, like you said, ABC approach, but you will insert urinary catheter and you will give IV fluid. This is first thing you will do. Then second thing, you will stop medication, ACE inhibitor and metformin, okay? Number 3, you will see the result or update from culture she took from first admission, and you will consider changing the antibiotic because she has still fever till last night. So you have now more than 48 hours on antibiotic and not resolving fever. You should consider changing the antibiotic, okay? After that, if he asks for investigation, I run some investigation basic as we did, and I can also septic profile, as you said, also septic profile, including chest X-ray, including blood culture, including other urine sample and the inflammatory markers. Okay. In the scenario, they added like immune profile and electrophoresis and C3, and C4 protein, immunoglobulin, and also Benz-Jones protein in urine for myeloma. But I think it is away, but it can be part of workup just to exclude others. And very important, as you said, the ultrasound or CT to exclude any hydrophorus and hydroureter because it will be like the pyelonephritis will not improve till this resolve it, the hydronephrosis or hydroureter. Okay. I think this is all for scenario. If you have any comment or you need to add anything. Anyone here? Anyone have comment or question? Dr. Basim, you are here? You comment.
Yeah, thank you, Dr. Aisha. Sorry, I had the internet problem, or the Zoom disconnected me. Nice case, as usual, interesting one. So the only word I should add here, acute kidney injury, which is, yes, makes sense to mention it. All this happened, it's called acute kidney injury. Whatever the reason
Yes.
behind, either UTI, sepsis, or even drug side effect, but I should mention AKI because she has deteriorated of her kidney function, and you're right, this all due to uremia and the vomiting, I mean, due to uremia, and all also related to what's called acute kidney injury due to infection or the medication, whatever the reason. Yes, a nice case. I think you covered all the topic from investigation, management, and how to approach the case.
And don't forget the catheter, urinary catheter as first.
Police catheter, yes. But suppose patient with urosepsis, suppose she's on Follis, but I should ask and to offer it. Yes, you're right, because she's admitted since 3 days. So I should ask this question. Okay. Any question? Sorry, I lost the chat, so I can't see the previous message. Anyone has comment or question he can add? Any comment
Nice,
also?
nice case, Dr. Aisha. But I want to ask if any patient with acute kidney injury يعني must be overloaded صح, not dehydrated. Dehydrated is the cause صح, but now if he
Yes, but
started
it's
to
still in the start. If you review the scenario, it is like just yesterday, and it is still the create 160, and it is from dehydration. He's still in
Yes.
the start of the deterioration. He had vomit 3 times. He have nausea because the pyelonephritis itself, it is not managed well. So she has like vomiting and dehydrated. So it is just enter the zone of, because she is admitted, so they pick it early.
Yes, I agree
And they
with
will
Dr.
not
Aisha.
bring in exam someone in really acute stage.
Yes,
In some case,
heart
if
failure.
they will bring, yes, if they will bring one case, they will bring mild like this. That's just manageable and not in very acute stage.
Yes, thank you, Dr. Sir, for the question. I can add also answer to your question. As AKI due to hypovolemia or perirenal azotemia, just little hydration, everything will be fine. But under one occasion, that the kidney is not nephropathic one. Some patient like diabetic nephropathy with little dehydration, it might be more complicated even after good hydration. It might complicate it more and to be at, for example, if we have the staging for the kidney, which is called rifle criteria staging. So the patient might be in stage 3 with little dehydration, he will be worse in the kidney function. And with little drug-induced or medication toxicity or nephrotoxicity, he might or she might be in stage 4 and even stage 5 and in the stage renal disease for dialysis. So according to the condition of the kidney previously or pre this infection, some patients they rapidly deteriorated to in the stage renal disease and they might need also dialysis. So according to the nephropathy and the kidney state, if normal kidney, definitely it will improve the hydration. But if chronic kidney disease, it might be deteriorated and complicated with end-stage renal disease with dependent dialysis. Any question? Other question?
Dr. Basim,
Yes.
Dr. Basim, can you
Mhm.
differentiate between acute tubular necrosis and interstitial nephritis in
Yes.
the clinical and the investigation wise?
Yeah. Interstitial nephritis, it's like a reactional response to the antibiotics, and you might have fever and rash and eosinophilia in the blood test. Acute tubular necrosis, it's kidney injury due to the medication, and you might have leukocyte or leukocyte count in the urine due to the necrosis itself, and no rash, no fever. It's just worsening kidney function. I think clear now, or you need
Yes,
more?
thank you. So,
Yeah.
طيب, what is the picture of the renal injury in analgesic nephropathy? Is it acute tubular necrosis?
No,
Analgesic
acute tubular
nephropathy.
I think it's different. I'm not sure. You mean the non-steroidal, right?
Yes, yes.
Analgesic nephropathy, I think it's another
Interstitial.
category. If someone knows more about it, they can share. But these are the most common with
What's your
gentamicin.
question?
The question, what the analgesic nephropathy present? How the analgesic nephropathy can present?
As interstitial
According to
nephritis.
what happened, but it is most probably يعني most common acute tubular necrosis. Interstitial, some other
So
situation.
you mean it's a major term and it might be with these two conditions, right?
Yes,
Yes,
according
yes.
to what the cause. In acute tubular necrosis, it is
Okay.
like muddy brown cast. You will the
Yeah.
condition different from interstitial, as Dr. Bassem said. It is like rash and fever. In interstitial, you will find like inflammatory condition.
Mhm. Yes.
But in acute tubular
acute
necrosis, you will deterioration in kidney function suddenly. You will maybe not find any systemic like any signs.
No reaction, yes.
Mm.
No systemic reaction. Someone was talking in the background. Okay. I think the important not to give the histological diagnosis before biopsy. We just say AKI, sure, yes, agree. But we give the possibility. You can give the possibility. But you can't say this is acute tubular necrosis unless you have urine analysis and you have the evidence by the kidney function worsening, the history of medication or nephrotoxic medication use. Yes, I agree. Dr. Hadil presented as nephrotic syndrome. I think also nephrotic syndrome, one of the subtypes under the term of analgesic nephropathy. So analgesic nephropathy is a major term for acute tubular necrosis and nephrotic syndrome and interstitial nephritis. So it's collecting all these under the umbrella of analgesic nephropathy. Okay, until collecting other comment, Dr. Aisha, your patient, Mrs. Tala,
Okay. Tala.
35 years. Tala, yes.
Tala. Okay.
Yes, Tala. With muscle
35.
pain, 35, complain of muscle pain and fatigue.
Fatigue. Okay.
Dr. Basim, another question. It is not related to the case, but if the surrogate told me that he is sexually active, does that mean that he is having HIV?
I should ask more about his sexual activity by questioning him. How is your sexual relationship? Is it protected one or no? You have single partner or multiple
All the
partner?
rest, all the rest.
Yeah,
Okay.
you should ask them. I asked the question for HIV, like one question because I didn't have time to ask all that question or all the question for HIV, like sharing needles, the pruning. And if I see that this patient is not risky to have HIV, or I'm not suspecting this patient to have HIV, what HIV in the UTI? Unless he's immunocompromised, but I suspected it's like local cause, reflux uropathy, because she has history of renal stone before and UTI before. But if you suspect HIV in any young patient with the risky habit and he has multiple infection, you should ask and screen all HIV because what I see is HIV question wasting time and it
Yes.
might not, yeah, it might not to be related to the case. And by this way, you waste the examination time and wasting the finding and so on. You will be minus in the examination and clinical judgment for what's
Yes.
called HIV question. So leave the HIV question for the patient who is suspected to have HIV and complicated with HIV infection. Cachectic patient, lymph node, high fever, recurrent infection, all these types of patient presentation, you should ask about HIV. This is
Okay.
also what I want
Just
to do in the training, okay? Not to waste time for unnecessary questions. Yes.
just I wonder if he is sexually active but has no
Mhm.
other risk factor for HIV. That made me assuming that he is having HIV
There is
without
other
other risk
risk.
factor, sharing needle,
No.
tattooing, just sexually active.
Yes, it might be source of infection.
It might be
The
something,
only
yes.
yes, of course. For example, if he has multiple partner, this one put him under the risk of HIV. If he has a male partner, if he is male and he has male partner, this is risky for HIV. So the risk and the behavior itself can predispose to HIV. And only the sexual history. So you might have all negative sharing needles and tattooing and piercing, blood transfusion, but he is sexually active. And not only that, he had maybe he's sexually active and he has one partner or single partner. This is okay. But if he told you, no, I have multiple partner, you have to ask, how
Multiple
is your,
partner, yes,
yeah,
the risk is
are you
increased with
using
multiple partner.
protection? Yeah, if multiple partner, not using protector, this is risk for HIV.
Yeah.
Multiple
Excellent.
partner or male partner without protecting, also this is risk for HIV. These in bases, I mean. Okay.
Yes, thank you, Dr. Basim.
You're most welcome. So Aisha, ready?
Yes, ready.
Yes, let's start. Okay, here you go.
Hello, I am Dr. Mtwali covering the clinic today. May I confirm you are Mrs. Tala, 35
Yes, I
years?
am. I am, yes.
Okay. I am here today, Ms. Tala, to talk to you about your health condition and may I need to examine you. Is this okay with you?
Mm-hmm. Sure, doctor.
Okay, I can take some notes that we will remain confidential. This is okay.
Sure.
Okay. I saw from your notes that you have some muscle pain and fatigue. Can you tell me more about that?
Yeah, doctor. Actually, this started 2 days back, and I'm not feeling well, doctor.
2 days?
Yes.
Mm-hmm. And this is first time you feel like that?
Yeah, first time ever.
And this started gradually or suddenly?
It's like gradual, doctor, but it's worsening, progressing.
I'm sorry for that. And when you feel exactly the pain,
Yeah, the pain everywhere, doctor. All my muscle
where?
aching.
Mm. Okay, I'm sorry for you. And you find that you have some weakness with pain or just pain?
No, doctor, just pain, and I'm not feeling energetic to do any exercise or to do anything.
Mhm. Do you have any recent travel?
Uh, yeah, doctor, you're right. I just came from travel, yes.
Please, what time are not working?
Are you sure?
Timer. Okay, sorry.
No, no, it's okay.
So, okay. So, you have recent travel. From where you come and when you come?
Yeah, from Canada, doctor. I was in Canada.
Was your first time to go to there?
Yeah, yeah.
Mm. For how many days you stay?
I stayed there for 2 weeks.
2 weeks. And where exactly you stay? Do you have camping? Do you going to bare areas like
Yeah,
any?
doctor. I was going for outside, doctor. I like to go to the mountains and to the forest. Yeah, I like this life.
Mhm. And you are okay when you are there.
Yeah, I was okay, but all the symptoms started after I came back.
When you came back?
I came back 2 weeks ago.
Mhm. Okay, anyone with you in this trip?
Yeah, I travel with my friends in a group.
Mhm. Anyone of them are sick?
No, doctor, actually, I'm the only one have this problem.
You have high temperature?
Yeah, doctor, not high, but I feel my body hot.
Mhm. Okay. Do you feel like headache?
Yeah, sure, doctor. Yeah, this is also bothering me. I have headache all over my head.
Mm. And it come like behind your eye exactly, or you didn't notice that?
No, no, it's all over, doctor.
Mm. If you grade your pain in your muscle from 1 to 10, uh, how you will grade your pain?
It's like 5, doctor.
Mhm. And the headache?
The same, doctor. 5 to 6 out of 10.
Mhm. Do you need now any painkiller I can offer to
No,
you?
I just talk, doctor. I received already.
Okay, okay. So you have any rash or any skin changes you notice?
Actually, doctor, I noticed some skin change. It's too weird, doctor, but it like disappear. But I have a photo for it when I got it.
Uh, can you see me?
Yeah, I will show you, doctor.
It is came 2 days ago.
No, it was 1 week ago.
1 week ago. Okay.
Yes, I'm trying to post it or share it.
On group or here?
No, no, the screen.
Okay.
Okay, go ahead. Continue
Okay.
concern. I can. Yeah,
Uh,
this is the rash.
okay. 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 So you have any joint pain apart from muscle pain?
Yeah, you're right, doctor. All my joints also are aching.
Any swelling in them or just pain?
No, no, just pain.
Any chest pain?
No,
Okay. Any soreness anywhere, like any ulcers in mouth or anywhere in your
no,
body? Any
no,
rash apart from this you notice?
no.
Okay. Can you tell me I'll ask you some private question, and I'm sorry, but it's really important for in your case. Do you have like any casual relationship when you are abroad?
No, doctor, I have partner, but I traveled alone. However, I didn't have any relationship.
Okay. I'm sorry for this question. Also, any sharing needle, any tattoos?
No, doctor. No, I'm not.
Okay. Do you have any past medical history I should be aware of?
No, I am completely fine.
Do you take any medication?
I took medication for this ache, muscle ache, and it's called paracetamol. And sometimes I take Profen.
Okay. Any other medication? Any herbal
No.
medication?
No,
Any surgery in the past?
no.
Some other private question.
Mhm.
Your period is regular?
Yes, doctor.
When was the last period?
3 weeks ago.
Okay. Do you use any contraceptive tablet?
Yes, I have taken some pills for my what's called birth control pill. Yes.
Okay. Do you have any recent weight changes?
No, doctor.
Okay. Any night sweat?
No.
Do you feel like you do not tolerate the cold or the hot recently?
No.
Do you smoke? Still?
No.
Do you drink alcohol?
Yes, doctor.
How much?
Socially at the weekend.
So it is within social limits?
Yes.
Okay. With whom you live, Stan?
My partner.
Okay. Do you need any support at home?
No, doctor, I'm fine.
What do you do for living?
I'm accountant.
In this condition, I think it would affect you in your job.
Yeah, doctor. A lot.
Okay, I'll offer for you some help in our occupational health worker. Is this okay with
Thank
you?
you.
Okay. Do you feel any change in your vision?
No, doctor.
Okay. Any tummy pain?
No.
Throwing up?
No.
Being sick?
No.
Change in bowel habit?
No.
Okay. Do you have any change in your water role?
No.
No change in like become black or frozy?
No.
Okay. Do you feel awareness in your heartbeat?
No, I'm fine.
Okay. May I examine you?
Yes, sure.
Okay, I'll see the vital signs first. Blood pressure, pulse.
Yeah, 120/80, pulse 80, temperature 37.5.
Okay. And any posture drop, blood pressure?
No.
Okay, I'll check the eye. Any pallor or jaundice?
No pallor, no jaundice.
Okay, I'll check any special, any redness in the face, any drop in eyelid.
Yes, actually, there is the face. If you want to see her face. So what you are suspecting, apart from dropped eyelid? Facial asymmetry? Okay, this is her face. You can see the screen?
Yes. Okay.
Okay.
Do you have any difficulty in swallowing?
No.
Okay. Do you notice this weakness in your face, or that you can't chew good your food?
No, doctor, it's only the shape is little weird, but I think it's maybe someone, my friend told me maybe due to the cold exposure.
Mm-hmm. And what time you notice it this changes?
It's since 3 days now.
Mm-hmm. And you have any pain in the ear, on this side, on the left side?
No,
Any pain on the area behind the ear?
no,
Okay, can I palpate this area, please? Any swelling in parotid?
yes, no parotid swelling, no parotid tenderness.
Okay, I'll examine the facial nerve palsy. I'll ask her to raise eyebrow.
Excellent. Yeah, eyebrows, there is weakness.
She can't raise the eyebrow on the left
She
side.
can't.
On
Yeah.
only on the left, okay. And I'll ask her to try to blow. She can't.
Yeah, she can't, yes. There is some
And to
defect.
show her teeth.
Also, there is asymmetry and deviation.
Okay. I'll ask her to see I'll ask her to see the tongue and movement of the tongue and uvula.
No, intact.
No problem. Okay. I'll ask her. You can hear me good. No problem in hearing. Yeah.
Yes.
Okay. Any discharge from the ear?
No.
Okay. Any like flu-like symptoms like last 2 days?
No.
Okay. I'll examine the lymph nodes in the neck.
Okay.
Any lymph nodes and
Yeah, there is mild lymphadenopathy, cervical,
submandibular, cervical,
and cervical and
anterior and
submandibular.
posterior. Okay.
Yes.
And occipital.
Yeah.
Okay. I'll see also. I see the thyroid. Any swelling in the neck?
No, nothing. 2
Okay.
minutes remaining.
Okay. I'll auscultate the heart. No problem.
Nothing. But good question.
Okay.
Yes.
Okay.
No delayed. No heart problem. I mean conduction problem.
Okay. I'll auscultate the base of the lung. No
Nothing.
any. Okay.
Nothing.
Okay. I'll see the rash that she see me. If no oozing, no scaling,
No.
no, and it is only one.
Yes, only one.
Okay. And I see the lower limb edema.
Nothing.
No lower limb edema.
Mhm.
Okay. What is your concern, Mrs. Tala?
Why I feel fatigue, doctor, all the time and this muscle pain?
Okay, I appreciate your concern and I'll try to help you much. We need to run some tests for you, but right now I think you have some bugs. You catch it from your travel. Even it's 2 weeks you come back, but this bug can remain not active for this period. Do you have any other concern?
Yeah, what's in my face, doctor? Is it something related to this bug or this, what's called, what you said?
Yes, I think it can be related or can be other problem. As you said, it can be like cold exposure or you have some problem in your nerve behind your ear, running behind your ear, and we will investigate this also.
Okay, thank you. Time is up. Yes, tell me, present your case. Or you want to take a breath? You want to collect
Okay,
your
no
thoughts?
problem. Can continue.
Okay, go ahead. Yeah, tell me, present the case.
Okay, this
Take
is
a breath
middle.
and then start. Yes.
Okay, I hope. Okay. This is a middle-aged female. She presented with muscle pain and fatigue for 2 days with high temperature and joint pain and some rash. This is I think it is like erythema multiformis. Also, she has recent travel to Canada, and she become in outside places like camping and mountains, and she has also headaches, and she has by examination facial nerve palsy on left side, and she has this erythema multiformis, and also I noticed some lymphadenopathy along the neck. Okay.
Okay. So give me a differential. What's your differential here?
Okay, for the muscle pain, yes.
Muscle pain and all conditions.
Oh, okay. My differential to be infection related to these places, it is maybe rock mountain fever or dengue fever, or also what other viruses maybe in these places.
Okay, so you think it's tropical disease?
Tropical, yes.
Okay, and why the patient has facial palsy?
I think maybe some viruses like herpes or any, I think maybe any viruses can cause disease in the facial nerve.
Okay. So we can ask about facial palsy causes. You can remember the disease from the facial palsy
Yes,
causes.
if it's related to condition, maybe infectious, or
Mhm.
maybe it is
Like,
apart from this.
what infection can lead to facial palsy, you know?
I know herpes.
Okay.
Maybe
Herpes, no, herpes will cause Ramsay-Hunt syndrome, you mean? Ramsay-Hunt syndrome, but it will be like rash and only around the eyelids.
mm,
Okay. Facial palsy as a causes, you remember? HIV, one of the causes. And there is also
yes.
bilateral and unilateral unilateral and bilateral facial palsy. You remember one of the infection common? Okay, the rash in the hand, what's called erythema migrans.
Migrants,
Okay,
not
erythema, yeah,
multiformis.
no, multiform, no. Erythema migrans. Okay,
Okay.
and patient was hiking, doing some hiking.
ممكن influenza also,
Uh,
I think.
no, okay,
Bestienbar.
no. Okay,
Okay.
already all wrote it in the chat box. Okay, it's I want to say it because okay, let's do the investigation. What investigation you can do for this patient to reach the diagnosis?
Okay, I'll do basic investigation and
Okay.
CBC like liver function, kidney function, and inflammatory markers and
Mhm.
electrolytes. I'll do also for her like serology for common viruses in these places, and I'll do urine analysis. I'll do X-ray also for chest, and for facial palsy, I may need to do MRI
Okay.
for brain.
If you suspect Lyme disease,
Lyme
what
disease.
specific test you will do for Lyme disease?
I don't know. I can.
Antibodies.
This is from
Screen for
rats,
antibodies.
yes? From
Not
rats?
rats. It's Lyme. It's tick.
Tick-borne? Oh, okay.
Yes.
What is
Okay.
the test?
The test, yeah. You screen for antibodies.
Antibodies for
Okay.
the, it is, I think,
Yeah. Lyme.
Borrella? Okay.
Okay. Let's manage this patient. How you manage this patient?
Okay,
Yes,
I'll
Eliza by Eliza, yes.
okay. I'll start by ABC approach. I'll rehydrate the patient, giving symptomatic management. Then I'll like start here or steroid for the facial palsy, And if suspected virus, I can give antiviral. I also will include in my management a physiotherapist for the facial palsy, and I can also include the infection disease unit, and I'll notify
Okay.
about the disease if we find some of them. Okay.
Okay. So what is the pharmacological and option for antibiotics in this patient?
Antibiotics. I think doxycycline or
Excellent. Yes.
doxa.
Excellent. Doxycycline. Yes. And if your patient, and this
Allergic?
question will be excellent. So you have to ask about allergy. You didn't. You ask all medical
Yes.
except allergy. Okay. If the patient
Yeah.
allergic, and one of the treatment is amoxicillin, but if the patient allergic to penicillin, what antibiotic? So we have now first doxycycline, the second amoxicillin. The third
Okay.
option, if the patient allergic to amoxicillin or penicillin, what you will give?
atypical هي طيب ممكن
أيوة.
أزيثرو
Excellent.
مثلا.
Excellent. Yes. So doxy, amoxicillin, azithro, and doxy is contraindicated in
which one?
pregnancy.
Doctor?
Pregnancy. Doxycycline. Yes.
Yes, for dental problem.
So
I think.
yes, so
okay.
this is the line of management. The DAA, doxycycline contraindicated in pregnancy, and amoxicillin, and you can't give an allergy, penicillin allergy, and if allergic, you can give azithromycin. Okay, the last question. What if the patient has signs of meningitis? What you could give him, or arthritis?
I go to check next steps. For meningitis, you should give something passing blood-brain barrier.
So what's the option?
It is what is chloromfenicol? I don't know what.
No, ceftriaxone.
Ceftriaxone.
Okay, so
Okay.
yes,
Okay.
meningitis and septic arthritis, injection by ceftriaxone in case of bacteremia or spreading infection by Lyme disease. Okay.
Okay.
Okay. Well, thank you, Dr. Aisha. Well done.
Thank you. Very good case, and first
Yeah.
time I practice. Thank you.
Yeah, that's why. Yeah, to be first, and in the exam, if you face it, you can remember it because it's
Yes.
coming in the exam. As facial palsy, yeah, it present in diet the last year, and it was like a facial palsy case. And
So,
after
Lyme disease can cause facial palsy.
yes, this is one of the commonest cause of facial palsy, unilateral and bilateral. It can lead to,
Okay.
especially if spreading. Okay. So I think, yeah, well
It's
done.
common
I will
in
start.
Canada. Okay.
Not Canada, any hiking in some tropical. Yeah, there is some geographic
Any
distribution, but
tick-borne, and I should ask also if she
yeah,
has any tick-borne at. Do you notice
exactly.
any tick-borne?
This is what I will
And this
comment on in
erythema
the travel.
migrans from the
Yes,
site of tick-borne or not related?
yes. No,
From
no,
site?
it's the, yeah, this is the site of bite.
Okay. Yes.
It
Fine.
started in the bite and it will migrate like this. Okay. So
Okay.
starting from the travel, you catch it from asking travel history, and it was like I said she catch the case, but
For
you
today
didn't ask
only.
me.
Maybe
No,
it's
it will
very
be presented late. It might present late, but it's okay. 2 days,
the
it's
symptoms
okay.
for 2 days. It is acute condition. Any acute condition, you will think first thing about
Okay,
infection.
yeah. Okay, good. But the travel analysis you should know, and we should know in young
Yes.
patients traveling abroad, we have to ask certain question. If diarrhea, what have you been eat there? Did you eat from the restaurant, from the hotel, or from the what's called local restaurant, or from the street restaurant? This question for diarrhea, and if you suspect something like traveler diarrhea, okay, this is for diarrhea. For
It was
skin
in
rash,
mind, it's a tick-borne, but
yes, I
I
know,
forgot it. And also,
Yeah,
like if she was in lake area or
Yes.
I don't know what is we can call this. If
I think malaria, you mean
no, no.
malaria from
yes يعني لو نزل في مية أو حاجة فيها زي بركة
okay.
أو مش عارفة بتسأل ازاي.
For leptospirosis? What the
Yes, I think.
disease?
I don't know, but this
Okay,
one
okay.
question.
بالهرزيزس can be بالهرزيزس.
I think
But bilharzia
bilharziosis is
already
now not.
no more. Yes, no more, not
because,
present. Yes. Leptospirosis sewer. Leptospirosis for sewer.
Yes,
Okay.
leptospirosis for, but this one not travel history. I think maybe not travel history. It is
Yeah, but
like a
it's
farmer
occupational.
working. Occupational.
Yeah, occupational.
Yes. Mm.
Okay, let's go back to the traveler. So what the question for traveler? If you suspect skin rash and you have skin rash, where did you stay? Did you stay in the mountain, outside, in the forest? And when you stay, did you use net, mosquito net? Did you put some creams protecting? And last question, did you ever bitten by any mosquito, by any insect? So you might have the skin or contact with some insects, like our case. And the question, the target question in Lyme is the hiking. With the hiking and some ticks in the forest. Okay, this is for the travel history. Jaundice as well for the liver. You can ask for hepatitis and as any infection, viral infection can infect the liver. Dengue fever, I like the question for the headache. You have headache behind your eyes. Yes, this is specific for dengue. But again, dengue will be for mosquito. So the same question for mosquito, the same question I mentioned. Some other question for histoplasmosis like cave, Legionella in the hotel. This is a related question to the disease. Legionella and the hotel, some cruises as well. Beach cruises, this is for Legionella, but you will have pneumonia, I mean, and you should ask for the hyponatremia and urine Legionella antigen. I think the cholera also, it will be like GI, gastroenteritis, traveler diarrhea as well. So this is traveler infection in faces. I think we cover most of them. Malaria, of course, on the top in Kenya and South Africa. And again, the same question, did you use nets? Did you put some protection in the skin? Did you have any mosquito bite? And the question for malaria signs and symptoms will be in the system review, but this is the travel screening, okay? So let's start from the beginning. Onset, course, duration. You ask all the CNS, the headache, the vision. But when you suspect Lyme, you have to ask this question: the facial asymmetry, and the arthralgia, and the constitutional symptoms. Also, you ask. Then the other system review will not be significant, apart from if the heart affected, you might have bradycardia as a conduction problem. And this will be in the awareness of heartbeat or the examination in the pulse. Okay, meningitis difficult to be to bring this case. I mean, but it happened as a complication. Meningitis by Lyme disease. It can be there. Arthritis as well, septic arthritis, and this is the only indication for ceftriaxone. Apart from this, the management will be, as I said, doxycycline, but in contraindication pregnancy, amoxicillin, but in case of penicillin allergy, you can give azithromycin. This is for the management. Okay, let's go back to the family history. You didn't ask, but you asked about any other member in the travel had the same problem. The female history as well, you ask. HIV, you screen quickly, I agree in this case. And the job smoking alcohol, you cover all this question. The examination, target examination, the skin rash, erythema migrans, and the vitals, then the face for facial palsy, and you should do screening and test for cranial nerve, seventh cranial nerve, and its lower motor neuron lesion, so you will have all the face affected. By the way, the side deviated, it will not be the affected one. The other side is the one affected. So let's imagine in this patient, which side the nerve affected in this patient? What do you think, Dr. Aisha? Which side is affected, the right or? Excellent, yes, the right. So the right, and you will ask all tests for the muscle and the power of the uh, orbicularis muscle. Yes, open your eyes and you can resist, or raise up your eyebrows. Then blow. Can you blow? And can you smile for me? All these questions can show you the weakness in the face and facial palsy as lower motor neuron lesion. All face will be affected. Differential, other examination like heart as you did, and the facial we did already, the lymph node and the skin rash. By the way, it might be presented late, the infection and the signs and symptoms. It might be 2 weeks to present. Our differential, we can put Lyme on the top, and you can put other viral also infection like dengue fever. It can present with the same presentation and signs and symptoms. I think difficult to put other or difficult to recall other infection, tropical infection, I mean. But if someone know other infection from tropical areas by the name, they can. I mean, Rocky Mountain fever. Yeah, okay, it can present, but I think it's certain areas. I'm not sure which are they, but if someone knows about them, they can recall us, recall them and remind us. Rocky Mountain fever. I'm not sure. It didn't come before in the basis, by the way. But Lyme, because of the facial palsy, it might present, and you should do examination of the cranial nerve. And one candidate I know, she attended the exam and she had this case. She had this case in the exam. Okay, let's see the comment.
So for cranial nerve also we will check
Only 7.
7 almost.
Yeah. If you suspect meningitis, you have to do examination for meningitis, meningism, and stiffness, Kerner sign, and Brzezinski sign. Okay, Lyme, erythema migrans, erythema chronicum, this rash. No, it's called erythema migrans. Lyme, muscle pain, fever, erythema migrans, facial palsy, traveling, this with Lyme disease. Excellent, yes, Dr. Hadil. ELISA for antibodies, yes. Specific test, but general investigation will not be signifying any finding. Pregnancy, contraindicated doxycycline, yes, you're right. Any fever in a scenario, you usually must think an infectious disease first as cause. Yeah, I agree. Yeah, thank you. Thank you, doctor. Any other comment, question before? Dr. Aisha, you have any question?
No, thank you. Thank you.
Thank you also for your case. It was an interesting one. Yeah, I like your case, Dr. Aisha. Yeah, thank you.
But this is very good case, really, that
Yeah,
you
yeah.
give me. I
The unique.
really was misdate this disease from very long
No
time.
problem, but you'll never miss it again. This is the aim
So
of our meeting and discussion
yes,
and practice. The
yes, inshallah.
weird and strange case and rare presentation we have to do, and because the common is common and we all of us know the common, but the rare case, I hope like your case also, it's rare case, and if you practice it once, it will be permanent in your memory. But the old case, the known case, I mean, yeah, we can catch it, inshallah, hopefully. Okay, any question from others? Thank you, Dr. Hadil. Yeah, thank you too. Okay. If no more question, we can end the session. See you tomorrow, inshallah, with the communication. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
عليكم السلام.